Hey everyone, we are going to talk briefly about parent consultation today. Um, Similar to what you've been doing with teachers, or what you know of in the educational or classroom setting, you're going to be doing with parents less frequently than with teachers and administrators, but you will still encounter parent consultation, especially if a parent gives you a call and they've got a problem occurring within the home. So it will look a little different. So I just wanted to give you a little bit of some tips as we move forward when working with parents. So some things to know about parent consultation. Similar to working with teachers, it is not therapy. We are not providing parents with any therapeutic, like counseling sessions per se. We're providing them with a service that helps them solve a problem. We are not necessarily trying to educate them, although there will be some education that comes along with teaching them about interventions. So similar to teacher consultation, it is an indirect intervention. So where you are providing the parents a support indirectly to impact the client. With parent consultation, we are trying to determine problems that exist in a family system that are related to one or more of the kids' maladaptive functioning. So often, as we know, it's not usually the kid problem. There's something else going on. So while you're working to solve the problem that is occurring, such as an example would be executive function within a kid, you need to be looking at what might be going on within the home setting or within the environment that might be leading to some of the concerns. So you have to be careful because you're not trying to do therapy, but you are trying to pick away at some pieces as to maybe there's some disorganization. Maybe the parent also struggles with this and that was passed on to their kids. So trying to find ways to piece that out is really important. This is also designed to assist parents in increasing their understanding of the problems and helping them design and implement solutions. So helping them to understand, what is going on within the family system and things that they need to be able to change the situation. Um, Parent consultation is appropriate for some and not appropriate for others. So it's appropriate for parents who lack basic knowledge of parenting principles. Not saying that they're a bad parent, but they might be young. They might not have an idea of like what they're doing, navigating, a kid who's 8 years old, that maybe that's their first child and they're not really sure how to get through a certain situation. They might lack a skill to implement a solution to a problem. Or they might have unrealistic or dysfunctional expectations of what's going on. Often this is the case where I'll have parents call and they'll say, my kid's doing this. And then I'll say, but every kid that age is doing that. Like we've got this really different normative sample that we can choose from because we see hundreds of kids a day. Whereas a parent with one 8-year-old might not understand that that's pretty typical of an 8-year-old. Parent consultation is not appropriate for parents who have or families that have pathological behavior as the source of the problem. For example, if you have a parent with a personality disorder, that is going to be very difficult for you to move forward with parent consultation because that ends up often being the case for the behavior in the first place. Not necessarily the personality disorder, but you know what I mean. Like I had a parent who did have borderline personality disorder, and we heard from her every day. And there was a lot of resistance. There was a lot of splitting behavior that occurred. She called me one day, and then she called teacher another day, and it was really difficult to do any kind of consultation with her because that ended up being the issue that led to the behavior. And then also, if you've got a family who's having really severe marital difficulties that's impacting the parent process, you're not going to get through. There's just so many factors that you have to dig into. So you have to find a way to get in there with your consultation with the knowledge of consultation probably is not going to be that effective if you have those things going on. There are different models of parent consultation. They end up being pretty eclectic. We have been learning in this consultation class to use more of a behavioral approach. One model that I want to mention to you that we're not really using, but you will have probably a blend of this in the future, is conjoint behavioral consultation. Tom Cradwell developed this model. It's an indirect approach to consultation in which parents and teachers are involved in addressing the needs of a kid. So you would have a teacher and a parent present during consultation sessions and be problem solving with both. So it's really cool. It's really team-oriented approach. It can be a little messy when you have more people involved, but if you have the right team members there to assist with the problem, especially to hit it from a home perspective and a school perspective, you're able to get a lot done. Okay, parent consultation process. First off, initiating contact, right? That's how we would start with any type of consultation. You are stressing outcomes that are dependent upon joint effort, telling the parent, like, we're in this together, similar to what you would do with a teacher. Establishing appointments, finding out what times work, and trying to stick to a schedule as much as possible. But also at the same time being flexible and knowing that parents might have multiple kids, they've got a spouse, they've got, a job, they've got other things that they've got to manage. So if they have to cancel an appointment, being understanding of what that means and how to reschedule pretty easily. Explain why the consultation is being initiated. Explain the roles similar to what you would do with a teacher, and you would set your goals and make sure to avoid therapy. I've had a lot of parents seek me out as a school psychologist because I have psychologist in my title, and you will too, where they will want to turn the sessions sometimes into talking about them, and it ends up getting in the way of your process. So if that ever happens, always go back to the kid. All right, step number 2, assessment. This is a really big deal when you're working with families, determining the values, the structure that the family has. And what I mean by this is, like, for example, some parents don't necessarily value education, and that's not an insult. It's just that they might have grown up not really valuing education. That's what they were taught. They maybe didn't go to college, maybe they didn't finish high school. And so that's important to know, because then you're going to understand how much effort they're going to be putting in behind that consultation. Do they care enough? So questions you want to ask. You want to ask about modeling influences, like who are they learning from? How are they learning to parent? Family functioning. What are the dynamics like? Who gets along with who doesn't? Who's in charge of discipline? Communication. How do family members communicate? Does it tend to be a bit more, nonverbal, verbal? Is there a lot of yelling? Are you talking about your feelings? What kind of conversations are you having? Acculturation, very important to understand, especially if you've got families who are coming from different countries. Where are they at within their acculturation process? And then importance of the problem. So similar to what you would do with teachers in terms of that prioritizing, finding out how big of a deal this is, maybe on a scale of 1 to 10, where are we at with this problem? Step number 3, set goals. Very similar to what you've learned, you want to set goals for the client, which is the kid. Obviously, this is what we're trying to work for in consultation. And then you want to set goals for the consultee, which is the parent. How can you as the parent help your child? Getting that buy-in from them. Why do they care? Why is this important for them to solve the problem? And how are they going to help you with this? Step number 4, selecting interventions. This is a really big deal, and something you have to keep in mind is that parents don't have the type of training and skills that teachers do. Again, not an insult to parents, but they're just not necessarily taught how to parent. Like, teachers went to school to learn how to be teachers. Like, you don't go to school to learn how to be a parent. So you want to always keep it simple. You don't want to bring in too many things, and you want to write everything out. Making sure that you have that fidelity checklist as much as possible. Allowing the parent to choose the intervention. Don't go in there and say, okay, what do you want to do? Go in there with a few ideas and allow the parent to choose from your ideas. Train them very specifically how to use the intervention, and ask them to show you so you can check for understanding that they know how to implement it correctly. Talk about potential consequences of the intervention. Let them know the behavior is likely to get worse before it gets better. I reiterate this to every teacher that I work with, especially when we're changing up a behavior intervention plan, because there are going to be there are increases in behavior before it does get better. We know this. This is just common knowledge. Plan to include the kid if you can, especially if the child's of training age, and you can bring them into a session with you when you're there and doing the training with the parent by saying, like, hey, this is what mom's going to be doing with you. This is what dad's going to be doing with you. Make sure interventions are culturally sensitive, and you're going to understand this better after you do your assessment, after you ask them questions about what works and what doesn't work in families. And then make sure to explain psychological principles. Don't feel like you need to skip past explaining, like, this is positive reinforcement and this is why we do this. It's actually proven to be effective. get them to buy into it just as you've bought into it when you've been learning about psychology in your past. Step number 5, follow up and evaluation. Again, similar to what you've learned. Review progress that's been made toward the goals that have been established, and then troubleshoot. Find out where things are going wrong, where things are going right. Re-examine the home situation. Remember that things, just as they do in life, constantly change, and you need to always go back and ask questions like, okay, it wasn't working this week. Was there anything different about your household this week? Maybe dad lost his job. Maybe there's been, a financial stressor or otherwise. Maybe there's been a potential like separation or divorce that occurred. These things pop up out of nowhere. And then making sure parents are always aware about the termination of the consultation, because you're not always going to be involved. And make sure that parent understands, what the problem is and what the solution is. And so then they can move forward, being able to implement the intervention on their own. Some other strategies for maintaining equality within the relationship: allow them to accept or reject the intervention, similar to what you do with teachers. If you don't have buy-in, they're not going to do it. Encourage the consultee to contribute suggestions, like go in with ideas, but allow them to give you some things back because they know the kid, they know their home environment. Emphasize their contributions. It's really important that they feel included, and remind them, like, your kid, like, you got this. Let me just help you along the way. Encourage their responsibility so they know what they need to do, and they are also buying in along the way, and they don't lose focus. Require effort from them. Tell them, like, I need you. We can't do this without you. And make sure to act in that non-authoritarian way, that they understand that you are equal with them. You are just this person with the school psychology experience, just as similar as I describe it to all of you when I come into a classroom. Like, I am not better than you. I just have a little bit more experience than you do as a school psychologist. So that's where I'm coming from. And I want to teach you that, but we're here together. You've got as much stake in the game as I do. If parents are meeting you somewhere, be prepared to meet them upon arrival. I do this a lot actually with my team meetings too, where I will go out always and meet the parent before they come in. And I'll walk with them to the room and I'll say, hey, so-and-so's in this meeting, and this is what we're going to be talking about today. Do you have any questions? Well, it's just the two of us. Immediately reassure them that the process is to work collaboratively with you to benefit their kid. And you might need to remind them of this, especially if there's some tension or any resistance. If others are going to be involved, bring them in after the parents are comfortable, build rapport with them first, and then say, like, hey, I was thinking we can have Johnny's teacher on the call today. Would that be okay with you? Always discuss confidentiality, similar to what you do with teachers. Like, you don't want parents to feel judged. So you want them to know, like, right off the bat, hey, like, this is between me and you. If something is occurring, like, you are, your child's in trouble. There's some potential for abuse that I'm suspecting. Those are things that I have to report, but otherwise this is just me and you working together. Establish an informal atmosphere, make them feel comfortable. Don't have it where you're just sitting down and everyone's in suits and you have to act a certain way. Like, just be yourself. If the consultation is occurring at home, be a good guest. I know that's really simple, but just keep that in mind. And then always be considering the cultural background of parents. I mean, this is really important, even when it comes to like customs, such as like taking off your shoes in a house. I know that a lot of people just do that naturally, but that could be a cultural factor that you need to consider when you're doing that consultation. If there is resistance, remind them that they came to the consultation because of their kid and because of the behaviors that they're having. And so you might need to break down that resistance, similar to what we talked about last week. Like, why is this occurring? What can I be doing to help you? Like, and maybe figuring out more the parent issues as opposed to, what's going on with the kid's behavior first. Two parents don't have to be involved in consultation. It is more effective when both partners are involved, but that doesn't need to be the case. So don't feel like it's not going to be effective if you don't have both parents involved. Okay, that's all I got for today. I'm going to film another video on some parent consultation interventions for you. So I will be posting that, and I look forward to seeing you all this week.